We are now going to begin the Q&A session. So if you have a question, please add it to the chat now. Okay, Dr. González, this first one is for you. Regarding your charts, it appears white exposure is trending slightly higher. Do you know why? Could it be that people are becoming used to exposure, proximity to oil, gas production, distribution?
Yeah, very observant question. I think I'll start by saying, so this data is coming from the U.S. Census Bureau, and obviously there's a lot of constraints in the U.S. Census definition of white or any of these racial groups. It includes a very diverse set of people, including some people of color, like North African, Middle Eastern people tend to fall under white, but sometimes face disproportionately high exposures. But that's in a conversation for another day. I think that's a good question, and we have some data to get at that. So I'm just going to show a couple of figures here. So I think this is what you were talking to. We see some slight increase in the proportion of non-Hispanic white people that are living near active wells. And I think that may be attributable to, first of all, there's disproportionately low exposure consistently throughout the study period. But when we look at this by county, we found something surprising, or at least that surprised me, that when we look at Kern County, which is the county with the highest oil and gas production, not the most exposed people, but the most oil and gas production, it was in fact non-Hispanic white people who had the highest exposure. And we saw increasing exposure or there was disproportionately high exposure among non-Hispanic white people, rather, and American Indian and Alaska Native people, and inverse to what we saw in Los Angeles, or statewide, which I think is driven by Los Angeles. So we're seeing there's more new wells being drilled in areas of Kern County where there's, or rather, non-Hispanic white people are disproportionately in areas where new wells are being drilled. That may be what's driving that. But again, I'll note that non-Hispanic white people across the state did not have disproportionately high exposure. But in Kern County, they did, and I think that gets at the complexity of this issue. Happy to talk about that more, but I hope that answered your question.
Thank you. Dr. Deziel, a question for you. Is the growing waste stream being included in looking at the health and environmental impacts?
That's a great question. I would include that in sort of other ancillary infrastructure. So to my knowledge, I think there certainly have been some studies that have looked at some of these ancillary infrastructures like compressor stations, waste ponds, but it's not the focus of most of the literature. And I think that could be another useful next step.
Here's a question for both of you. At what point will the health impacts of fracking be sufficient to vote out politicians who support the economic benefits?
Yeah, I'm not a policy maker, so I don't feel like I can answer that. But I believe that the amount of evidence that has accumulated over the past decade certainly warrants policymakers considering this, taking a look at it, at a minimum, revisiting the setback distances to account for all of this literature.
Yeah, my response is, I think in terms of policy regime, we tend to not proactively prohibit industrial activities that may be harmful, but rather regulate them after they've been shown to demonstrate harm. That is just a regime that exists in our policy. That's not a regime that needs to exist among the voters, of course. There's a precautionary principle which would indicate that, rather than like waiting for evidence of harm to accumulate and allowing for, in some cases, many people to die, which is what we seem to be seeing, if we were to believe what we're seeing, like causal evidence of oil and gas causing these sorts of adverse health outcomes that has resulted in adverse health and in preventable mortality. There's other ways that this could be approached. Voters, if they choose, could take on a precautionary approach, would be to say, like, we should not allow practices that have not been proven to be safe. So rather than putting the burden of proof on people suffering the exposure, the burden would be on the potential emitters to demonstrate that their practices are safe. I think that is, again, not a question for, that is a very difficult question, and I think obviously up to groups like the League of Women Voters, I think, to do the great work that you all are doing to organize folks around these issues.
And maybe I can add too, the top of the pyramid that I showed was elimination or reduction of oil and gas. And that may sound like a stark departure from our status quo, but actually several states have passed initiatives banning or restricting unconventional oil and gas development, like Maryland. I think there's certainly larger setbacks that have passed in California. David could speak to that more, but there are other municipalities that have either banned hydraulic fracturing, like in Delaware, or have banned receipt of fracking waste. So there are examples of different municipalities and states taking stronger action to reduce drilling.
Thank you. Another question for you, Dr. González. Have you encountered university level advocacy and partnership with the fracking industry, promoting the industry as safe without scientific data presented to the public to support this claim? This happened here in Pennsylvania between 2010 and 2012.
I haven't personally encountered that, but my alma mater, Stanford University, was recently there was a study published that found that there's more that universities like Stanford that receive funding from industry that seems to correlate with the publishing of more studies that promote or at least align with industry aims. So I think it's really hard to establish like whether this is like, causal, to use a scientific language here, but I think that we see patterns where industry is putting money into universities. The industry is pointing to the fact that they are funding universities, and then the universities are producing evidence that supports some of the economic aims of the oil and gas industry. Whether there is, I think it's hard to like really pick apart what's going on there, but these things are things that we've seen.
And in Connecticut, we don't have shale deposits, so it's not really, I guess, an issue, and maybe that's better because the research can sort of be insulated from any of these apparent or real forces.
A question for you, Dr. Deziel. With an increase in state legislation to protect the unborn, is there sufficient data to challenge permitting in proximity to communities in our courts?
I think
question for both of you, really.
Yeah, go ahead.
Yeah, I think that'd be a fantastic question for folks with legal expertise. I'm not a courtroom lawyer, but I know that we are recommending. So the report that Dr. Deziel mentioned, we're concluding that there's causal links between oil and gas development and adverse birth outcomes. I think that's standard of evidence. I think it would be important to consider in any of these decisions, but again, it is far outside my area of expertise to comment on whether that would hold up in court.
Yeah, and I guess I would just echo that or add that if people really do care about babies and are pro-life, they should be if they're not just be pro-birth, but also, want to protect children. So I think there's a lot of evidence to say that we can do better in protecting children.
I got a private or a DM question, if it's okay if I take that, about redlining and whether it extends to Pennsylvania, like our findings and whether it extends to Pennsylvania. Sure. So this was a question in the chat. How do you think this is state specific? Do you have any idea of how translatable these findings might be to Pennsylvania? For the redlining study specifically that I mentioned, which I can put the link in the chat because it's, again, free to read. We use data from across the U.S., so 33 cities, including, I'll just show the map really quick, including several cities in Pennsylvania. Most of what we were seeing was driven by Los Angeles, given that it's the city with the most urban oil and gas development. But we saw relatively consistent patterns of places that had poorer grades by the agency that did the redlining had consistently had more oil and gas wells. But again, I think, if anything, I think this might raise more questions than it answers because redlining correlates with so many other layers of policy that happened over the years. So, but I did want to say that that study was national, not just California.
A question for both of you. If you think about the past 10 years of fracking and research, do you see one or more turning points?
That's a really interesting question. When I think back on it, I see kind of a steady accumulation and growth and building of block upon block where, things started out with relatively simple exposure metrics. Now we have wind-weighted models and, groundwater modeling. We started out looking only at birth outcomes, and now we're able to look at cancer, cardiovascular endpoints, respiratory endpoints. So no specific turning point comes to mind. To me, it feels more like this steady building and building of evidence.
Yeah, and I'll just say, I think this is, being a still like very much an early career scientist, kind of seeing how this work has evolved just in the time that I've been training. I think we as a scientific community, I think really push ourselves to be better, to ask deeper, more detailed questions. I think that process, at least in the case of oil and gas, there were earlier waves of studies that found associations that I think a lot of us agreed we should follow up on and do deeper research into. And that's involved epidemiologists like us, it's involved engineers, it's involved political scientists. So I think, as this field continues to mature, I think that the way, just to echo what Dr. Deziel just said, we're asking deeper questions, we're asking better questions, and I think we're finding, or we're asking the same questions but in more detailed ways, and I think we're finding, in many cases, consistent findings. With respect to the environmental justice literature, just to contrast, that literature I think, is not matured with respect to oil and gas. I think that with respect to turning points, I don't know. I would like to see more people looking at the policies that might be driving these disparities, and I think seeing more consistency in how we're trying to understand who's exposed and who might be overly burdened. I think those would be the turning points that would be valuable, but that literature is a lot less developed at this point.
One more question before we wrap up. The Department of Health in Colorado and Pennsylvania in a lit review downplayed the importance of epidemiological studies. What is the best way to support the importance of epidemiological studies in public health?
Well, I think epidemiologic studies are this is the main tool we have to study this question. The only better designed study is a randomized trial, and we couldn't possibly randomize people to live near oil and gas or not. So I think perhaps sort of the Bradford Hill criteria that I showed to really say this is what epidemiology is designed to look at these associations. And while one study alone cannot prove causality, when we look at the evidence in totality, we can apply these important criteria and evaluate studies with respect to these criteria, and come to some important synthesis of these results.
Yeah, I think stripping away the labels that we put on these disciplines, like what does it mean to do an epidemiological study? I think community members living near oil wells, certainly in California and certainly elsewhere, have expressed concern that, hey, we're seeing higher rates of cancer in our community. We're seeing more sick people in our community. We think this is due to the oil wells. That is an important source of information, but it's difficult to pick that apart from all the other things that could cause these sorts of health outcomes that we care about, that we want to prevent as public health scientists. So the tool that we use to answer these questions in a bit more generalized way is epidemiology. It has that label, but what are we doing here? Simply what we're doing is trying to do the best, most logical job. Are people that are living near oil and gas wells, can we figure out who they are? Can we figure out what they're exposed to? Can we figure out a good comparison group that's like them but wasn't exposed? That's tricky, but that's what we as epidemiologists try to do. And then once we have these two comparison groups, can we estimate, okay, for those that had the exposure or more exposure, did they have higher? There's not really, it's not like a magical process. It's just, or even really that complicated when you break it down. We're just trying to do the best job we can of answering these questions that people have. So, does any scientific study matter? I believe it does. That's why we're here. But I think, targeting these studies and saying that it shouldn't be considered in a dearth of evidence, I think would be misguided, because we ask these questions. They're important questions, and I think to some extent it's the best answer that we can have is using these studies, even though our methods are constrained because of the limits of doing this kind of work. But it matters, and I think it is one of the best ways that we can answer these questions that matter to people.